Hello there, students. So I thought we would do another COVID update. It's been quite a while since I've talked about this. Um, so let's just take a quick look at where we are. A really good website you can use to track the statistics of COVID in Canada is covid19canada.com. And there's a ton of information on here. It can be kind of hard to sort through, but let's take a minute and try to look at some of this stuff. So we have just recently, I think yesterday, passed the 100,000 mark. That's how many cases we have had in Canada so far. And you can see the world has 8.6 million. Now, if we drill into the data a little bit, you can see that Quebec has had the most cases in Canada. Ontario has had a lot as well. Obviously, Ontario just has a lot of people compared to other provinces, so that's to be expected. Um, and let's see, what else can we look at? We can look at some graphs. So let's take a look at the provincial graphs. So Ontario is here in blue, Quebec is purple. If you're wondering what the deal is with this big spike, Quebec reclassified a bunch of cases that they had previously not classified as COVID, and they decided they counted as COVID. So it's not like they had that many cases in one day. They just changed the way that they were classifying cases. Anyway, so let's take a look at Ontario because that's where we are. So this is in blue, and you can see that it was in late March, early April that we started to accelerate how many cases we were seeing, and it stayed at the peak throughout April basically, and it started to come down. And in May, we were having around 400 cases every day, and then starting in June, it's starting to come down, and just recently we are getting under 200. So we're now seeing under 200 cases per day. And things are going well. So, yeah, our case numbers are going down every day in Ontario. We never really saw a truly terrible surge like they did in some other parts of the world, like New York City and like in northern Italy. So we're doing pretty well overall. Now, what else can we look at here? So another place you can go. Oh, this is not this. Okay, so this is graphs. So if you go to the COVID-19 site and you go to graphs, there are actually a ton of graphs on here, and I mean you can feel free to peruse this as much as you want if you're interested. Another thing to look at is testing. So people have been talking about how it's really important to do lots of testing. And you can see actually Ontario has really accelerated its testing. Doug Ford got mad a couple weeks ago that we weren't testing enough. And so since then, we have started to test more and more. And you can see that our testing is way higher than any other province, um, which makes sense again because we have a lot of people. But if you compare it to cases, I mean, Quebec has more cases than us, but we have way more testing than Quebec. So in terms of testing, we're doing pretty well on testing, and especially recently. Now, I don't. Some of you may have been tested. I'm not sure. If you haven't been, it's possible that as we do more and more testing, it's possible that um, more people are going to need to get tested. For example, like if you go back to school, it might be the case that they require you to get tested. I'm making that up. I don't know if that's going to happen. I've heard that they might actually require teachers to get tested. I haven't heard anything about students, but so the test is like a swab that they kind of stick up your nose. I have some friends who have had it. Everybody tells me that it's uncomfortable, but it doesn't hurt and it's very quick. So it's really not that bad, at least according to what some people have told me. Okay, so let's see what else we can see in these graphs. A lot of them are kind of redundant. So they might be sort of telling you the same information. And a lot of them are just like the same graph broken down into different provinces. Anyway, if you're interested, you can take a look at this. So another website we can look at is Worldometers, which is a pretty good website for keeping track of the whole world. So, you know, in the last couple weeks, it sort of seems, or more than that, in the last month or so, or even more, it's kind of felt like it's slowing down. Like it's not as much of a panic as it was in April and in late March. But actually, if you look at the worldwide numbers, we're actually we're setting records every day. Like worldwide, coronavirus is worse than it's ever been in terms of the number of cases. Now, in Canada, it seems to be getting better, but it's been spreading to different parts of the world. And of course, that's a risk because if there are a lot of people getting infected in different parts of the world, then if there's travel, then they can spread that around and it can come back to Canada. Right now, there's not a whole lot of travel happening, but the question is how long can we go without allowing people to travel? Who knows? I don't really know. But it's possible that at some point governments say we're going to have to start travel again. But if the virus is still going around, then it could be brought into Canada from other places. Anyway, let's take a look. I'll show you this website. You can kind of see how to navigate this website. So if you scroll down, you'll see the number of cases on the day, like today. But let's just take a look at yesterday. So yesterday there were 140,000 new cases, and we can see where the hotspots are. So America is still seeing a ton of cases every day, even though the whole country is reopening, which is a little bit crazy. Obviously, politically, it's more divisive in America. All 50 states are reopening, but but a whole lot of states are having their worst outbreaks right now. Brazil is one of the hardest hit countries right now, and then places like Russia and India are seeing a lot of new cases every day. The big European countries that were having the worst outbreak in April are doing much better. UK, Spain, and especially Italy has seen a drastic decrease in their cases. And we were hearing all about Italy and Spain, but if you look at these other countries are way ahead, have way more cases than them in total now, Brazil and Russia and India. Here we are down here, 367 new cases yesterday, 46 people died. And you can see some of the other countries. So there are a lot of cases happening in Latin America right now. If we look at places like Brazil, Peru, Chile, Mexico, and so on. There are also a lot of cases happening in the Middle East and South Asia, such as India, and there's Pakistan is having a lot of cases, Saudi Arabia, Bangladesh. So those are sort of the parts of the world that it's worst right now. And once again, there are lots of graphs and things on this website that you can look at on your own. Now, one thing to make a note of is that actually, even though the cases we're seeing the most cases right now that we've ever seen, we're actually not seeing the most deaths. We saw higher death rates in April, and that I'm not totally sure why that's the case. It's possible that's because in April, when COVID was hitting European countries on average have older populations than where the current outbreak is, like in South America and in the Middle East and India. Those countries have younger populations, and younger people don't seem to be dying as much from COVID. So that's possibly why the death rate is lower right now. But that it's probably more complicated than that. That's just a theory of mine, a hypothesis of mine that might be totally wrong. Okay, so what else can we look at? So what we've learned, this is obviously, like, when this thing first came around, scientists didn't have any understanding of it because it was so new. And what we knew about it on, say, March 12th or March 13th, when we were on our last day of school before we started remote learning, we've learned a lot more since then. So this is a quick update of what we know about the virus. That might be a little bit more updated since the last time we spoke about it together as a class. So the transmission happens mostly indoors. As time has gone on, it's become summer in a lot of the places that have been hit by COVID, and so people are spending more time outdoors, and it does seem to be the case that it's harder for the virus to be transmitted outdoors because of the airflow. When you're inside a room, there's not much airflow. When you're outside, there's tons of airflow, and it just seems to be the case that the virus disperses when there's airflow, whereas when you have stale air just kind of sitting around, it's easier for it to sort of pass from one person to another person. The surface transmission is less prominent than initially thought, and what I mean by that is surfaces like tables or um, chairs, poles on the subway, things like that. Picking the virus up off a surface and then rubbing your face and then getting infected, it does happen, but it's less common than we were afraid of. So you don't need to be as worried about that. You should still take precautions, but it's not as much of a worry. But the droplet transmission is the main form. So especially indoors, droplets, people cough or sneeze, or it doesn't even have to be from a cough or a sneeze, because even just from talking or sort of regular day-to-day activities, you expel some droplets. More if you sneeze, but you can't avoid expelling droplets. And so when you're inside and when you are in a space with other people, that is where the the transmission mostly happens. And masks seem to help a lot. So places are starting to make masks mandatory, including in Canada. They've started to talk about making masks mandatory on public transit, like the TTC. I would expect that to continue. It's possible they're going to make masks mandatory in, like any indoor space. It's possible you'll be wearing masks in school next year. So get used to it. But it really does protect. It doesn't just protect you; it protects other people. So when you're wearing a mask, the point is not really to prevent the droplet from coming into your face. It's more to prevent the virus or the droplet from going out if you have it, and you might not even know that you have it. But that's the best thing that masks do, is it prevents the droplets from getting out from anybody who's carrying the virus. Oops, I meant to animate this. Okay, what's going to happen? I'm sure you're wondering this. Nobody knows, but we can make some guesses. So there will probably be a second wave. In Canada, we're doing a pretty good job right now. It's slowing down. It's nowhere near zero. Like, we are certainly far from virus free in Canada. And even if we reach the point where we're virus free, so there's a good example of this. New Zealand was virus free for 2 weeks recently. They had 2 straight weeks where they had no new infections, and then they started to reopen because they declared the whole country to be virus free. And then they got 2 new cases from people who had come in from the UK. They were allowed to come in from the UK because of a dying relative. And I don't know how much it spread. Maybe they were able to contain it. I'm not sure, but these things can happen. And you just never know when it's going to come back. So you have to be really careful. Anyway, it's almost impossible to avoid, especially in a big country like Canada. So we're probably going to have a second wave. And when you think about how the virus transmits, it happens more indoors. So there's the potential for it to be much worse in the fall and the winter compared to the summer. Because in the summer, if everybody's outside, it's not going to spread as much. But if it's still around in the fall and the winter, some people are really worried about those times. So that's when you especially need to be really careful about wearing masks and taking all the proper health precautions. If you're wondering what's going to happen next school year, that plan is scheduled to be released sometime in June. We don't know exactly when, but Stephen Lecce has said it's going to be released in June for a detailed plan of the 2020-2021 school year. So you can keep an eye out for that if you're interested. The vaccine development is progressing rapidly. So previously, the fastest a vaccine has ever been produced for any disease ever is about 4 years. And that sounds like a long time because we've only been doing this for a few months. And if you think about, I'm going to have to do social distancing and wearing a mask and all this other stuff for 4 years, it sounds like a really long time. And it sounds kind of depressing, honestly. But this is the scientific effort that has been put towards developing a vaccine for COVID has been so widespread on such a large scale that is completely unprecedented. So it's possible that it could happen much faster than that, and there are something like over 100 different candidate vaccines that are already moving to certain testing phases. So there are a ton of potential vaccines out there. Um, there's a whole process they need to go through where they do testing. I'm not going to bore you with all the details, but it is quite possible the vaccine happens much faster than 4 years, and it seems to be going well from what I hear. So the bottom line, we're doing pretty well as a country. That does not mean that we should get complacent. If you look at the U.S. Thought they were doing well. Uh, Certain places in the U.S. are doing well. Like, for example, New York had a terrible outbreak, and they are doing much better now. But as a country, they're not, and they're reopening, and bad things could happen. We'll see. Overall, in Canada, we're doing pretty well. Our governments have worked pretty well together. For example, the provinces have worked well with the federal government, and the cities have done so as well. We are going to need to keep doing things like social distancing and mask wearing. We're going to need to keep doing that for a long time, possibly a couple years. And I know that's hard. It's hard for everybody, but if everybody does those things, then everybody's protected. And we haven't really had a terrible outbreak in Canada. We haven't had the situation where our hospitals are so full that we have to turn patients away, which has happened in other places. So, cautiously optimistic. We've been doing well, and if we keep doing those things like social distancing, then we can avoid the worst outbreaks. We're all in this together. And that is my COVID update. So please let me know if you have any questions, and I'd be happy to try to answer them for you.